So today I want to talk about the importance of consistency and compliance with the treatment plan that's given to you after your child's evaluation, and why that it's not only important from a clinical aspect but also from an administrative aspect. And that may seem silly, like why would I need to be compliant from an administrative standpoint, but basically when we do an evaluation, we are going to do a series of standardized tests and determine what the need is for the patient. And at that time, the therapist will determine what the treatment plan is. And that treatment plan is determined also based on consistency, because there are goals that they have to meet. And so, well, I'm sure that this is nothing new that you haven't ever heard before. What, from an administrative standpoint, how that can affect things is that your insurance typically will approve a certain number of visits, or you may have an insurance that, if you're a lucky one, that does unlimited visits, or it may be based on medical necessity. Your evaluation is basically the letter of medical necessity. We can submit that to your insurance and they can read everything that the therapist has done and determine that, oh, okay, yes, there is medical necessity there. Plus, they're going to be able to see the goals and how we intend to meet those goals. And of course, the therapist always has in mind that if this is the treatment plan and this is my suggestion for how many times a week that the patient needs to come in, this is how we're going to meet those goals. When it becomes an issue is if there are misses and we're not making up appointments, we're then out of compliance and out of consistency. And so what can happen is the insurance can actually come back and say, well, we're not meeting goals. And if you ask me for a certain amount of visits and you're not being seen a certain amount of visits, then we're not going to approve these services. Which can be pretty crummy for you at the end if you're stuck with that bill. So because we really truly strive for not just the best in clinical care, we want the experience for you as well as the patient to be exceptional. We want to be sure that we're helping you get the best out of your insurance benefits. So with that, that's one of the reasons why that we offer the flexibility model. Your child will be very familiar with all the therapists that we have in our clinic. And if your child's regular therapist may not be available for a reschedule, they can see anyone in the clinic and be familiar with them. And so the transition is not so difficult. And that also keeps them within compliance of that treatment plan. Again, we really, really strive for the best service and the best in the industry, and are glad that you choose Cutting Edge for your child's treatment needs. And we want to strongly live by our philosophy that we treat the family, not just the patient.